Hello, and welcome to the Pharmacy Times News Network. I'm Nicole Grisano and your host for our Pharmacy Week in Review. A new study indicates that new persistent opioid use is 46% higher among bariatric surgery patients than the general surgical population, according to a report in the American Journal of Pharmacy Benefits. Patients who undergo bariatric surgery typically receive an opioid prescription, with most discontinuing use within 2 weeks. However, the researchers discovered that about 1 in 4 bariatric surgery patients still use opioids 1 year post-operatively. Based on the findings, the authors suggest that providers screen patients for substance use risk factors, prescribe short-term opioid therapy, and perform local nerve blocks during surgery to reduce the need for long-term opioid use. FDA officials have approved an extended indication for cariprazine, Vraylar from Allergan, to include the maintenance treatment of adults with schizophrenia, PharmacyTimes.com reported. Cariprazine was previously approved for use in adults for the acute treatment of schizophrenia and acute treatment of manic or mixed episodes of bipolar I disorder. Cariprazine is a once-daily atypical antipsychotic with a recommended dose range of 3 to 6 milligrams a day for patients with bipolar I disorder and a recommended dose range of 1.5 to 6 milligrams a day for adults with schizophrenia. The supplemental new drug application approval to the FDA was based on a 72-week study that demonstrated the prevention of relapse in adult patients with schizophrenia who use cariprazine. A new study published by Nature suggests that 72 recently discovered genetic mutations may be involved with increasing the risk of breast cancer. These findings represent significant progress against the deadly disease, according to a report on Specialty Pharmacy Times. In the study, the authors analyzed data from 275,000 women and found 65 genetic variants that increase the risk of breast cancer, while another 7 increase the risk of estrogen receptor negative disease. These findings may allow researchers to better predict which nearby genes the risk variants may harness to increase breast cancer risk, according to the authors. The authors note that a more in-depth understanding of breast cancer can result in more rigorous screening recommendations. The hope is that better screening will catch cancers earlier and lead to more optimal outcomes. Pharmacists may receive more questions about Triumec if they have seen the advertisement for the prescription medication to treat HIV-1 infection in adults. The spot features 5 patients talking about moving forward. They are shown engaging in active lives, working, performing, getting together with friends, and exercising. The commercial notes that Triumec is a once-daily medication that can be taken anytime during the day. For more great coverage and practical information for today's pharmacist, visit our website and sign up for our daily e-news. And don't forget to follow us on Facebook, Twitter, and Instagram. Thanks for watching our Pharmacy Week in Review. I'm Nicole Grisano at the Pharmacy Times News Network.